All right, let's talk about peptides. Chances are you've seen them blowing up on your social media feed. Maybe you've heard about them in biohacking circles. They've really gone from this super niche medical thing to a huge wellness trend. And the promises? Everything from healing faster to literally reversing the aging process. But with all this noise, what's actually going on?
I mean, just listen to that. Turns back the clock, regrows hair, modulates thousands of genes. That doesn't even sound like a medical compound. It sounds like something out of a comic book. And that's the level of hype we're dealing with. It's this idea that one little molecule can be the fix for almost everything. And that really gets to the heart of it, doesn't it? Whenever the claims are that extraordinary, you have to be extra skeptical. So, are we really looking at the future of medicine here, or is it just the future of marketing?
Okay, so here's how we're going to tackle this. First, we'll break down the basic promise, what peptides even are. Then, we'll sort them into 3 different tiers to separate the science from the hype. We'll look at the specific peptides the biohackers are using, then dig into the huge, messy issue of where they come from. And finally, we'll ask the big one, are there long-term risks?
All right, let's start at square one. Before we can even touch the hype, the hope, or the risks, we have to get on the same page. What are we actually talking about when we use the word peptide?
So this is the most important thing to get right. Peptides are not nutrition. This isn't like eating protein and a steak. They are signaling molecules. Think of them like tiny little text messages that your body sends. They lock onto a cell and give it a very specific command, like, hey, release this hormone, or start repairing this tissue, or dial down inflammation. They aren't just supporting a system, they are giving it direct orders. And that right there is the key. Their power is both their incredible promise and their potential danger.
So now that we know they're basically powerful instructions, how do we make sense of all the different ones out there? Because not all peptides are created equal. The biggest mistake you can make is just lumping them all into one big category. To really understand what's going on, we need to put them on a spectrum based on the actual evidence.
So to cut through all that noise, we can break them down into 3 different tiers. This is a really helpful way to separate the stuff you get from your doctor from the stuff you might see being debated on Reddit. Tier 1, this is, well, it's just normal medicine. Insulin, Ozempic, these are peptides. They are FDA-approved drugs. They're backed by massive, long-term human trials. We know what they do, we know the side effects, and they're just a standard part of healthcare. No controversy here. Now, Tier 2 is where things get a little more nuanced. Here, we have peptides that do have solid human data, but, and this is a big but, it's for very specific groups with specific conditions. Take tesamorelin. It's proven to work for a very particular type of fat buildup in patients with HIV. The evidence is great for them, but it doesn't mean it's some magic bullet for any healthy person who just wants to lose a little weight. So the takeaway here is that context is everything. And that brings us to the 3rd tier, the experimental frontier. If Tier 1 is the pharmacy and Tier 2 is specialized medicine, Tier 3 is the Wild West. This is where almost all the online hype lives. This is where you hear about all the peptides for anti-aging, for injury recovery, and for performance. And this slide, wow, it really lays out the disconnect. Take BPC 157, the one everyone calls the Wolverine peptide for healing. It's been studied a ton in rats, but in humans, as you can see, there's been exactly 1 published study, and it only had 2 people in it. And for its popular sidekick, TB500, 0 human trials. The hype has just completely sprinted ahead of the actual human data. The story of GHKCU, the so-called copper peptide, is the perfect case study for this. You see, the science for using it on your skin, in creams and serums, is actually pretty good. There are a bunch of human studies showing it can help with skin quality. But the injectable version that the biohacking world is obsessed with, there is not a single published human clinical trial. It's like the science and the hype exist in 2 completely different universes. So what about those popular anti-aging stacks you hear about, like CJC and Ipamorelin? Well, let's use a little analogy. Think of your pituitary gland as a sponge that's full of growth hormone. CJC 1295 is basically a signal that tells your body to squeeze that sponge harder than it normally would, releasing a bigger pulse of GH. It's like stepping on the gas pedal. But your body is smart, right? It has a safety switch, a brake called somatostatin to keep you from releasing too much. Well, ipamorelin's job is to temporarily put a block on that brake. So when you put them together, you're stepping on the gas pedal and you're disabling the brake at the very same time. And that's how you get a much, much more powerful release of growth hormone. Okay, so we've seen the incredible promise, and we've also seen the
pretty shaky evidence for a lot of these experimental compounds. But that brings up a huge practical question. If these aren't approved drugs, where are people even getting them? And this leads us to the sourcing problem, which is honestly where the biggest and most immediate dangers are hiding. Look, when you get a prescription for a tier 1 peptide like Ozempic, you know exactly what you're getting. It's sterile, the dose is precise, but the second you step into that gray market of websites selling vials labeled for research use only, it's a completely different world. All the rules go out the window. There's no guarantee of purity, no guarantee of sterility, no guarantee you're getting the right dose. And this isn't just a guess. When the FDA did its own investigation and tested some of these products from online suppliers, they found that over 40% of them either had the wrong dose or were contaminated with something else. That's almost a coin toss on whether you're actually getting what you paid for. You think that's bad? It gets way, way worse. A recent study looked at injectable semaglutide, the stuff in Ozempic, that was being sold online. What they found was shocking. Some vials had purity rates as low as 7%, which means 93% of what was in that bottle was something else entirely. Just let that sink in. Now, you might be hearing some chatter about the legal landscape shifting, with pushes to make these peptides available through compounding pharmacies. This is definitely something to watch. If it happens, it could provide a much safer, regulated source. But we have to be super clear here. This is about access and safety. Changing the rules on who can sell a peptide doesn't magically create years of long-term human safety data that we just don't have. Okay, so let's play this out. Let's imagine you hit the jackpot. You find a pure, perfectly dosed source. You solve the sourcing problem. That's great, but it just leads us to the biggest, darkest unknown in this whole conversation. It brings us to the final question. Is there really such a thing as a biological free lunch? What happens when you push these powerful pathways for months or years on end? When you talk to experts, a few big worries keep coming up. Many of these peptides promote angiogenesis. That's the growth of new blood vessels. That's awesome if you're healing a torn muscle, but it's also exactly how a tumor gets the blood supply it needs to grow. Constantly pushing growth hormone can mess with your insulin sensitivity. But really, the biggest issue is just the unknown. We simply have zero long-term data on what most of these do in healthy people over 5, 10, or 20 years. The conversation you see online is all about the upside. Almost no one is talking about the potential trade-offs. And it really all boils down to this one simple, powerful idea. Every time you push a system in your body this hard, there's a trade-off. There's a consequence. Your body is all about balance, and many of these peptides are a very, very strong push in one specific direction. So that's where we land. Are the potential rewards really worth the unproven and, in some cases, unknown risks? The world of peptides is absolutely fascinating, and the science is moving fast. But right now, especially in that third tier, we are in a place where the stories, the hype, and the hope have completely outrun the hard, long-term safety data. And that is the puzzle you have to solve for yourself.